Assalamualaikum warahmatullahi ta'ala wabarakatuh, and good morning, ladies and gentlemen. Welcome to today's session of Breakfast at UMHealth webinar series. The title of today's webinar is Chasing Goal, Losing Ground, a critical review of Malaysia's current sports and health development. It is a great pleasure to have everyone to join us as we explore an important and timely topic that contrasts Malaysia's focus on medal-winning sports funding with broader grassroots health and preventive measures. Our speaker today is Dr. Alston Kwong, a senior lecturer and a consultant sports and exercise physician at the Department of Sports, University Malaya. Dr. Alston is also an advocate for ethical, inclusive sport reform, and he will share an evidence-based perspective synthesizing the latest national and international data to propose practical reforms aligned with RMK 13 goals. And please feel free to post your question or any question at the Q&A box at the bottom of the screens, and Dr. Alston will try to address them at the end if time permits, or response via email. And thank you once again for joining us today. And without further ado, let us welcome Dr. Alston. The screen is all yours.
Okay, good morning, ladies and gentlemen. Thanks, Prof. Shariff, for having me. So I will be presenting pressing topics which I think is relevant for our countries, which is chasing goal, losing grounds, a critical review of Malaysian sports and health developments. I'm Alston. I'm from Department of Sport Medicine at University Malaya. So without further ado, we will go into the topics further. As you can see, why is this this matter is urgent? According to National Health Mobility Survey, we have about 54%, which is actually more than half of Malaysians adult categorized under overweight and obese. And the same survey also shows that there's around 39.9% of the adults are physically inactive, and in our national health economy burdens, 4.2 GDPs are actually being allocated is actually quite a huge amount to combat the non-communicable disease. Okay, so you can see among the key health indicator in Malaysia, we are according to the WHO, we are actually the second highest country that have the highest rate of physical inactivity among the Southeast Asia regions. So when we talk about health, we cannot run away from doing physical activity, and that also related to exercise and sports. Okay, so let us see back from children and then up to the adulthood. So in terms of child and adolescents, there is about overall physical activity grade is only less than 26% are actually only meeting the guidelines, and only 20% of the adolescents, which is around the age of 13 to 17, are active. This is actually according to the WHO recommendations of having 60 minutes of exercise on 5 times per day, 5 times in a week. And school physical education, as we all know, usually is being replaced by a more core subjects because the education syllabus is so heavy nowadays. How about adulthood? We can see the same National Health Mobility Survey show that from 2015 to 2023, we actually have I would say a slightly weak curve. That means in 2019, we actually tend to a little bit of reduce, but in 2023, we actually bounced back with 29%, around 30% of adult is physically inactive, and then women is even higher in terms of physical activity rate, physical inactive rate compared to men. And we also realize that urban residents, compared to the rural residents, you'll be surprised that because of all the public transports and we actually doesn't actually fully utilize, where we tend to drive or we park nearer, and it's actually more urban resident is physically inactive compared to rural residents. So this actually show that there is somehow a growing crisis that actually happens that actually warrant us to really focusing on the healthcare development in our country. Are we going into curative treatments, or are we just spending more and more of our national GDP into buying more drugs and also more medicines? Or are we going to focus more on preventive health in a way which is more effective in terms of reducing the spending of the GDP on the health sector? And we can see that 54% of the Malaysian adults are overweight and obese, and we are we are not the highest, but we are the second highest. This is not the latest. The highest is actually our neighboring country, Philippines, but there is nothing to proud of. And children aged 5 to 17 have also about 30.4% of the are overweight and obesity. And you can see from 2015 to 2013, the latest National Health Mobility Survey, there is also a rise of the trend of overweight and obesity across the adults and also in children. And sometimes we always need to think back what are the causes that actually cause there is a increasing rate of overweight and obesities. One of the things that I find, and this is based on this critical review, is actually there is different ministry actually will actually decide on the policy of the physical activity or physical education at different level of our educations. Example, Ministry of Health, they have their mandate to come up with the physical education curriculums per minutes per week. And the primary school, the policy actually indicated that there is supposed to be 66, 67, more than about 100 minutes per, more than 100 minutes, 150 minutes per week, but only 67% of the primary school managed to achieve that. Okay, that is far beyond what the WHO recommended for children and adolescents. Okay, as you can see the graph, the secondary school children is even have a lower rate of physical activity compared to the primary school students. And how about university, the varsity or the collegial students? We know, okay, from Ministry of Education, now we move to Ministry of Higher Education, which a totally different ministry. Sometimes the inter-ministry is not easy to have collaborations and also to have a standardized or a well-planned blueprint in terms of development from the physical activity from grassroots up to the adults level. So we can see there is also most of the university student is actually not surprised to either there's no participation in sports, only 12.3%, and very little of them is actually have a regular exercise regimes. Okay, this actually could be attributed to the factor of definitely not UM because UM have a is one of the greenest campus in the world, and so we have a running path. Okay, it's actually very facilitate for exercise. But some of the university that are lacking of this comprehensive sport facilities, and also they also don't have a health monitoring for student athletes. Okay. So Ministry of Youth and Sports are dealing with the elite professional athletes, which is another group of populations. So you can see is different ministry handling different group of the Malaysians. So that's why sometimes when there is no synchronizations, okay, a lot of things cannot be properly implemented, enforced, and achieved. So the governance of the KBS, there's this rates operations with very limited interministerial coordinations, okay, from the critical level, and also one of the finding is a lack of this limited transparency in finding locations, which is the accountability issues. As we know, those that we have this road to goal policies or project, I would say the actually Ministry of Youth and Sport actually categorize the sport into those that have higher potential of getting the first Olympic gold medal compared to those that have less potential. So if you have higher potential, you will get more funding, but you have less potential, you definitely are either half or none being funded. So throughout my career, I actually see a lot of those not to say they are not famous, but it's just not that popular in our country. Example, Ukrainians, these athletes, she actually compete up to international level, but because there's no funding and there's no proper training ground in Malaysia, she have to go to Norway, Netherlands, and all these fundings is actually from her poor parents. So we can see, but we know to produce Olympians is actually not just Olympiads of 4 years or even 2 Olympiads or 8 years. It's actually take probably more than 8 years or even 12 years. So we cannot actually see any changes if it's just 4 years of implementation of grassroots training. So I find there is a huge need in terms of the grassroots development rather than focusing on the road to goal. Why do I say that? Because the funding allocation significance shows that there is very imbalance between the elite professional athletes that already at their elite level compared to those grassroots, the primary and the secondary students that have potential to actually leverage sports to excel. But the funding is very limited to them. Okay, and most of the funding is actually go to the Road to Goal program, in which the ministry hope to get the first Olympic gold. In fact, we already have so many Paralympic gold. I just couldn't understand why is one Olympic gold so important. Okay. Okay, so when we comparing this the elite focus and the grassroots investment, we can see that it's very skewed toward the road to goal. They are more towards medical coverage and also the medal potential. But in fact, what we actually want is actually more on a population, the reach out, the health impact if we actually invest on grassroots, cost-effective, cost benefit, effectiveness, and also sustainability sports. Because when we actually have kids which is healthy and also actively physically active, then there is a less likely they will develop obesity and overweight when they are going into adults, and they are less likely to have a, non-communicable disease. Okay. So another policies that being introduced is the Safe Sport Code. I'm sure everyone are quite familiar with this. Okay, so the Ministry of Sport, Youth and Sports actually introduced the Safe Sport Code in 2 years ago. So what we found that this Safe Sport Code is actually it is very in time. And it's very important because there is a consequence. It is actually from few of the reported whistleblower harassment and also bullying cases, either from the entourage or from coaches. Okay, but what is what shortcoming that we felt is from the critical review is the code itself is a voluntary guideline. It's just a guidelines, and there is no legal implementations for those actually conduct independent body that oversee the implementations. There's no protections for whistleblower, and most of the case that being reported somehow will be investigated, but we don't know how do they actually being managed, as there's no mandatory reporting or proper reporting requirements. Okay, when we compare to the international best practice, which is in the case of US, the Michelle Bao, US gymnast that actually being harassed, sexually abused by the sport physicians, they actually developed this Safe Sport Act itself, which is a legal authority, and those that actually will having harassment will be punished, and there's a body that implement this enforcement power, and it's a mandatory investigations. And there's also another stricter rules, which is the they come up with the athletes protection law. Okay, so I've been advocating for Safe Sport Act since 2015. This is one of the advocates of the safe sports 2 years ago. Is still not enough because it's just a diagram, it's just a guideline, but there is no legal enforcement. There is no independent body that oversee the implementations. Okay, now we move to the health development part. So the non-communicable disease actually represent a growing health and economic crisis. As you can see, we might actually having more and more people, populations with non-communicable health disease. Beside the physical health, we can also see that because of the physical health, the economic crisis, and all that, there is more and more individual that come with mental health disorder. Okay, and you can see even us that working at the Ministry of Health or Ministry of Education as a healthcare worker are also having the workforce challenges because a lot of the fresh graduate, especially from our university, are having talent drain from other country, and that's why we are having a huge workforce shortage and also the distribution issues. Okay, as you can see, the WHO recommendation ratio is 1/400. Okay, but only 50% annual attribute rate of a public sector doctor to private, and 2.3 thirds of the urban rural disparity is actually occur among the professional distributions. Okay, so we are far beyond the WHO. We are not far beyond. It's just that most of them are actually in the private sector. For a public sector, we are actually far beyond having that 1/400 ratios. Okay, and as I mentioned just now, we still want to spend more budget allocations in creative health rather than start focusing on preventive health. This actually is a time for us to have a deep reflections on this issue, because this actually will actually determines how the budgets being allocated and the shift of the healthcare system in our countries. Okay, so when we look into the current policies, I realized that it actually created significant disparity in sport participations across the demographic. As we can see, the sport participations is actually higher among male compared to female, and it's more in urban area. And you will be surprised, it's actually not surprised, the T20 is actually the one that having the leisure time to go for sports. In fact, me, the middle 40 and the B40, we have to do double or even triple jobs to actually to have a life of living. Okay, so the long-term consequences we can actually project out projections that there will be worsening of the healthcare because of the rising costs, the medical expenses, and also we don't have a national insurance coverage. Okay, so this will be more burdens to our national economy, and also have a huge impact in our countries. Okay, so the systemic governance issues actually threaten the effectiveness of Malaysian sport and health sectors. By using this benchmark of 0 to 100 scale, our current status, as you can see, we are far below the international benchmark of having structural integrity in terms of policy, the accountability, and also resource allocations in the health sector. Okay, so some of the recommendations that I actually propose from this critical review is actually to really establish a sustainable or statutory interministerial task force between sports, education, and also health ministry. It's difficult if they just work alone, and they don't. This doesn't work if it's one man just work alone and it's not having dialogue between the ministry. Okay, because physical activity have to start from the grassroots. Then the preventions will also start from the child and the adolescents. Okay. And second recommendation is to put more fundings in terms of grassroots development for physical activities. That includes probably to reduce some fundings to chasing the goal, but so that we don't lose the ground of losing those grassroots that having more obese and overweight kids. Okay. The third recommendation is about safe sports. I know there has been huge debates because the current certain law or legislations already have some protections to women in terms of harassments and abuse, but it's just not enough. And then it's actually very important to have a proper independent body that look into the safe spot code, but to have a safe spot authority that has the legal power in protecting the whistleblower. Okay, and the fourth recommendation is always preventive is always better than cure. So prevention health should actually be allocated more budgets with proper usage of the allocations by the community preventive health project rather than spending more money and buying more drugs on the pharmaceutical industry. Okay. The fifth recommendations is to have a national health insurance. This also has been very heavily debated, okay, because there is a lot of sector, a lot of factor involved. But as you can see, the health insurance is getting more and more stringent in terms of claiming and also compensates. So I think this the ministry really have to have a dialogue in terms of the with the help the insurance industry with those with the with the Ministry of Health. Otherwise, the one that actually you have to bear the consequences will be the general population like us. Okay, and the sixth recommendation is actually, since we are losing a lot of, it's time for us to actually consider a proper pipeline, workforce pipeline. Okay, if we train, we have to make sure the graduate have a intensive retention job or permanent positions. Otherwise, we will keep on losing our talents and the talent drains from neighboring countries. And to have a transparent funding is very important. So what we being funded, okay, have to be published, and this funding criteria will be based on the criteria, and the funding criteria will actually allocate the fund, and then we measure the outcome, and then we evaluate the effectiveness, and then we go back to assess the funding criteria. So it's actually a cycle of evaluation, allocation, measure expected outcome, and also revise the funding criteria. And the conclusion is I actually call to actions that it's time to act now before we lose another generation to prevent disease. So Malaysia stand at the critical crossroad for me from the critical review. By continuing the current path of the serious policies and the rising non-communicable disease, or embrace an integrated approach that prioritizes both sporting excellence and population health, we might actually more and more people will be having non-communicable disease, and more kids or adolescents will be will be suffering from childhood obesities. And not to mention, we also having this double burden conditions in which malnutrition and most of the mid or T20 they are obese or overweight. So this is a conditions that not supposed to happen in a country that is considered quite developed, but the reality we are still having these issues. Okay, this is my reference. Thank you for your attention, and feel free to ask me any questions. Thank you.
Thank you so much, Dr. Alston, for the thought-provoking talk. And I think we have one question from Taufik here. The question that he posed is, I have a question, Doctor. What is other initiatives from the government to increase fitness or sports participation among healthcare workers so that we can treat patients better?
I don't think as far as I concerns, most of the initiative is from the hospital itself, from the hospital governance, like PPUM. They actually encourage us to use the staircase to climb the Menara Selatan rather than using the lift that forever giving issues. So I don't think there is the Ministry of Health is looking into healthcare worker physical and mental health, and this is also one of the issues that we is actually quite pressing, and especially after the post-COVID, a lot of the healthcare worker is still unable to recover because of the phobia, anxiety, and also the unable to cope with the workloads. Yeah.
All right. Okay. I think I'm also interested to get more information about the gender disparity that you mentioned in your talk just now. Is it also seen in other countries?
Yeah, some of the countries, especially in Asia, okay, there is a very huge gender disparity, not just in terms of recreation sports, but it's also in an elite sport as well. That's why the Olympics games and the Paralympic games, they are so focused on having equal gender for all the sports. So in Paris, the last year, Paris 2024, they actually able to achieve almost 50% of gender equality in terms of the male and the females athletes. And in the coming Los Angeles 2028, there will be not only the athletes, but also the race officer, the entourage, and all the organizing of committees will have to have a gender equality, which is 50-50%. Okay, that is their aim.
All right. Interesting. Okay, we can do one more question, I suppose, because of the time. This is from an anonymous attendee. Sorry, I missed the earlier part of the talk. How best can we build an active lifestyle from childhood using a multi-ministry approach?
Okay, I do actually conducted a project, a physical activity project in a primary school. Okay, one of the things that we find very discouraging is there is a lot of red tape to introduce physical activities into the school, not from the teacher. The teacher is actually very cooperating. They're willing to learn the how to actually conduct those activities, but it's actually from the Ministry of Health, because they actually say our researcher is disturbing the student syllabus, the study time, and it actually cause the havoc in the school curriculum and all that. So it's difficult to actually have a dialogue, because it's very difficult to change someone that already in positions for so long, but just too comfortable, and it doesn't see the whole picture of we are actually one of the country that having the highest increased prevalence of childhood obesity.
Indeed, yeah, changes can be quite difficult and challenges to everybody, I suppose. Okay, and I think we have to wrap up for this session. And again, thank you so much, Dr. Alston, for your insightful and thought-provoking presentation. Your critical review has highlighted, hopefully, the need to balance elite sports ambitions with inclusive population-level health initiatives for Malaysia's holistic well-being and sustainable progress. The increasing prevalence of physical activities and rising rates of obesity and overweight in Malaysia are concerning public health challenges that threaten our national well-being. And these trends underscore the critical roles as medical professionals to play, not only in the clinical care, but also as advocates in prevention or preventive health and promoting active lifestyle and shaping effective policies. Your talk today highlights the urgent need for multi-sectorial approach to curb these issues and improve our health outcomes for everybody. We appreciate everyone's participations and question in the chat. If you have further queries or wish Alston, please feel free to reach out via the contact details have been shared earlier. We hope today's session inspires all of us to think deeply about how we develop sports and health policies going forward. And thank you for everybody's attentions and have a great day ahead. Thank you so much, everyone.
Thank you so much,
Bye.
Prof. Shariff, and thank you everyone